Welcome to the Carolina Beat. I'm your host, Christina Dees. Joining us today is Dr. Erla, Chief Medical Officer with Lower Cape Fear LifeCare, and she's going to be discussing palliative care. Dr. Erla, welcome to the show.
Thank you very much for having me.
Of course. You look amazing, by the way. I love the blue.
I do too.
Now, I understand you've recently changed your name from Lower Cape Fear Hospice to Lower Cape Fear LifeCare because of all of its services that you offer, including palliative care. So what exactly is palliative care?
Yes, so we changed the name to Lower Life Care as palliative care is one of our programs that we offer. Palliative care, also known as palliative medicine, is specialized medical care for people with a serious illness, regardless of the diagnosis. So we see people who have congestive heart failure, cancer, lung issues, anybody with a serious illness. And what palliative care, it's a team of physician, nurse practitioners, nurses, social work, chaplain support that provides an extra layer of support for the patient and the family as when they have a serious illness and dealing with all the issues that go along with that.
Well, how do you know if palliative care is right for you or a loved one?
If you have a serious illness and you're having difficulty with coping with the illness, with symptoms, we help manage pain, shortness of breath, nausea, depression, anxiety. And if you're having, trouble and the family's having difficulty with managing the patient or understanding what's going on with the disease, we are there as that extra layer of support and work with your physician. So a patient or family can ask their doctor, said, would palliative care benefit me? Or they can call us and we can certainly go through their case and tell them whether palliative care would help them or not.
Well, when or at what point should someone think about getting palliative care?
Palliative care is available whenever you have a serious illness at any stage. So for instance, a patient is diagnosed with cancer and they're going to be starting treatment and they're trying to navigate, chemotherapy, radiation, they might be having pain. Palliative care can be there right from the beginning to walk that journey with the patient and family. And then if the patient goes into remission, then the patient is discharged from palliative care. So it's available at any stage of a serious illness from the beginning throughout the whole illness.
Well, tell me, how would someone with a serious illness benefit from palliative care?
When you have a serious illness, there's many things you have to cope with. One of the issues is pain, so we help manage pain. Other is learning how to function with decreased limitations. How, practical things, social work support and the support of the nurse practitioner, the physician, to manage any symptoms that come up, but also to understand the stresses of illness and the support for the family. For instance, with a dementia patient, understanding how dementia affects a person and explaining it to the caregiver, why that patient might get angry, why that patient might get agitated, and trying to explain to the caregiver the disease progression and giving them the tools to help manage what's going on better to improve the quality of life for both the patient and the family.
So what does someone need to do if they want to get palliative care?
They can we have a website called whichcare.org. So whichcare.org, they can fill out a quiz and it helps them determine whether palliative care would benefit them or some other program that we offer. They can also discuss with their own personal physician whether they would benefit from palliative care, or they can pick up the phone and call us as well and we can discuss palliative care with them. We offer palliative care, in various settings. We offer, inpatient, we offer home visit program, as well as clinic visits. So we have a wide variety of services in palliative care. And as well, Lower Cape Fear LifeCare offers other programs. So finding out which care is right for you is something that you can pursue.
Great. Well, Dr. Erla, that's all the time we have. Thank you so much for joining us. And for those of you at home, the website is right there up on the screen. And as always, you can find that information and more all on our website at www.aytv3.com. Thanks again for watching, and we'll see you next time.